So when I was asked to give a SID talk from the organizers of this meeting, I said, of course, what's that? And they said, oh, it's just like a TED Talk. That didn't help me very much. So I asked my kids, and they said, Mom, go to the internet. So I went to the internet, and I watched some TED Talks. And I learned a few things about TED Talks, some of which I'll try to reflect in this talk. One thing I learned is you should talk about something you're passionate about. That won't be hard for me. Another thing is that you should tell a story, and I promise to do that. And the third, which is a little harder for me, is to make a bold statement, something a little outrageous. So here's my outrageous statement. I have the best job in the world. Okay, let me rephrase that. Being a clinical oncologist at the Dana-Farber is the best job in the world. Now, Dr. Benz has told us on a number of occasions that as he's stepping down and he's come to the search committee and he said, don't worry, you'll find someone because I have the best job. This is the best job in the world. And so, Dr. Benz, I hate to disagree with you, but I have the best job in the world. Why is it the best job in the world? Well, first of all, the people I get to work with. You've already seen some of that. You've met some of the people I get to work with. And the patients and their families, and the resources that, as a clinician, the Dana-Farber brings to my work that almost anywhere else in the world where you work as a clinical oncologist, you don't get those resources. You don't have those people by your side to help you take care of patients. I'll illustrate that with a story. The story starts with a woman named Catherine. And Catherine is 9 months pregnant, and everything's gone fine with her pregnancy. It's her first pregnancy. She's expecting a boy. And a few days before her due date, she starts to notice that the baby's not kicking as much. So she calls her obstetrician, and her obstetrician says, come in for an ultrasound. And she goes and gets an ultrasound at the Brigham and Women's Hospital right next door to the Dana-Farber. And on the ultrasound, they see a happy baby sucking his thumb, moving his arms, good heart rate, but his legs aren't moving quite as well. And the obstetrician comes in and looks at the ultrasonographer, and sure enough, they see a little tumor next to the spine. And a tumor next to the spine, compressing the spine, can cause paralysis. So they pick up the phone and they call the Pediatric Oncology program at the Jimmy Fund Clinic at the Dana-Farber, and they look for an expert in prenatal tumors. In fact, yes. An expert in a person who knows about a disease. The disease is called neuroblastoma. It's my colleague, Dr. Suzanne Schusterman. The disease is called neuroblastoma, which comes in a variety of forms, but is actually one of the most common tumors that occur in children even before they're born. Now, here's the story. Susan Schusterman, goes over, meets the family, looks at the ultrasound, arranges for a prenatal MRI, where the baby is seen in an MRI machine, confirms that the tumor looks a lot like a neuroblastoma, arranges for a biopsy, and for the pathologist to be there as soon as the biopsy is done. The mother goes back to the Brigham and Women's, has an immediate emergency C-section. The baby is born, has the biopsy. Dr. Schusterman looks under the microscope, decides it's neuroblastoma, and prescribes chemotherapy. Chemotherapy that we know, 1, is effective, 2, is the minimal amount of chemotherapy that will treat this tumor without causing harm to the child, and 3, replaces previous therapies that have been used in the past, radiation or surgery, that would leave the child damaged for life. So here's Henry. Henry's getting his first dose of chemotherapy. Henry got 4 cycles of chemotherapy in the Jimmy Fund Clinic, and he met all those people I was telling you about that surround what we do. His family met a psychologist to help them through this difficult time. There's a play lady, even for little babies, as he got older, who works in the Jimmy Fund Clinic. There are resource specialists. And of course, there are nurses. Nurses full of expertise and compassion in delivering chemotherapy to little babies. Henry was monitored for side effects of these chemotherapies with the expectation that he would grow up into a normal life. I spoke to Catherine last night because I wanted her permission to tell you about Henry, and she sent me his picture now. Here he is. He's on the baseball team, he sails. This year he's going to try hockey. Who could have a better job than that? Now, I want to tell you, cancer, we don't have all Henrys. There are sad cases. There are cases where the therapy doesn't go well, that are harder to cure, and if the child is cured or if the adult is cured, they're left with significant side effects. And that's not good enough, of course. And the research you heard about is incredibly important for changing the way we treat, both to make it more successful and make it such that patients have fewer side effects. However, no matter whether the patient is heading toward a cure or the patient, we unfortunately don't have a cure for them, that whole array of services, that whole expertise that was put in line for Henry is put in line for every patient at the Dana-Farber. We have a luxury of our own time as a resource to develop expertise, to focus on an individual patient, to gather up the team. We talk about team science a lot. It's also team medicine, and team medicine is expensive. And what you do in supporting the Dana-Farber helps me do my job, and the other doctors, pediatric oncologists and medical oncologists, do their job with such expertise. Sometimes when I am getting my hair cut or on Amtrak, and someone asks me, what do I do for a living? I'm sort of a little shy about saying, well, I take care of children with cancer, or I'm a pediatric oncologist, because they often say, oh, that's so sad, how could you do that? But over the years, what I've come to say is, I'm a pediatric oncologist. And they say, pediatric oncologist, that must be so sad. And I say, oh, no, it's the best job in the world. And I get to do it at the Dana-Farber, which is the best place to do it. I want to end with something that Dr. Sallin taught me and taught every one of our trainees. Those of you who watch House or ER, dating myself, you might remember that sometimes, or have trained in medicine, that sometimes we do a terrible thing. We talk about patients by their disease. We say things like, the heart attack in room 3, or the pneumonia in bed space 5. Well, Dr. Sallin, when you come here as a fellow to be trained, the first time you say the following, and it's going to sound terrible, I got a new Luke last night. A new Luke is leukemia. A new Luke came in last night, and Dr. Sallin will immediately cut you off and say, he is not a new Luke. He is a child with a new diagnosis of leukemia. At the Dana-Farber, you are not your disease. You are a person with a family, with your own special situation that you came in with and your own special needs. We talk about special sauce, and I think we talk about the word special meaning unusual, exceptional, but special also has the meaning of pertaining to an individual. It's special because it's special to me, or to you, or to your family. And that's what's unique about the Dana-Farber, that when I provide care, when Dr. Johnson provides care, when Dr. Walensky provides care, they're looking at an individual as a special person with special needs and a special family. And that's what we do at the Dana-Farber, and we do it because you help us do it. The clinical income from billing insurance could never cover what happened to Henry, and could never cover the many, many ways in which we help families at the Dana-Farber. And for that, I thank you.